We've been having a lot of conversations lately with hospitals about where to set their financial assistance eligibility criteria in their financial assistance policy. Especially the income piece is the biggest consideration. Where should a hospital set their benchmark for free care as a percentage of the federal poverty level, and where should they set their benchmark for reduced cost care or partial discounts in their financial assistance policy. And so I'm going to give you 3 different organization profiles and 3 different rules of thumb. Not saying this is absolutely where everyone across the country should set their financial assistance eligibility criteria, but this is a great place to start. And if you'd like to have a conversation with me about your policy and where yours is set, and to talk through, maybe you're considering updating your policy and modernizing it a little bit. I know a lot of them are still out there from 2015 when 501R rolled out. So your 3 instances are 1, critical access hospitals, 2, everything that's not a critical access hospital or a major urban medical center, and then 3 are those major metropolitan areas. Think New York, Philadelphia, your very large cities. Where to set those policies. And so for rural hospitals, I recommend that hospitals set their free care benchmark, regardless of insured status, at 200% of the federal poverty level. I also recommend that they set their partial discount at 300% of the federal poverty level. And a good ballpark for what that percentage discount should be is about 75% off the patient bill. For non-rural hospitals, but not your major metropolitan areas, I would set your free care benchmark at 250% of the federal poverty level, and I would set your partial discounts at 400% of the federal poverty level. And so households with income up to 400% could receive discounts in the neighborhood of 75%. Now, if we're talking about major urban areas, your large metropolitan areas, hospitals are, well, what we're seeing is a lot of them offer financial assistance to households up to 600% of the federal poverty level. I would still recommend setting your free care benchmark in the 250 to 300% range, since there are going to be a lot of underinsured people just due to high costs of living. But offering partial discounts and a sliding scale to patients up to 600% of the federal poverty level is a great way to ensure that your patients can maintain affordable access to care at your facility.